Translational research and practice. Integrating research findings into clinical practice. Translational research refers to the process of applying findings from basic scientific research to develop practical applications that improve clinical outcomes and patient care. In reproductive medicine, translational research plays a crucial role in bridging the gap between laboratory discoveries, basic science, and real-world clinical practices, ultimately improving fertility treatments, reproductive health care, and patient outcomes. The integration of research findings into clinical practice ensures that new evidence-based interventions are delivered to patients, optimizing fertility treatments and improving the overall effectiveness of reproductive health services. Below is a detailed exploration of translational research in reproductive medicine and the steps involved in integrating research findings into clinical practice. 1. What is translational research? Translational research is often referred to as bench-to-bedside research. It is the process of taking discoveries made in laboratories, basic research, and turning them into practical applications that can be used in the clinical setting to improve patient care. In reproductive medicine, this includes the development of new diagnostic tools, treatments, or therapies based on scientific discoveries. Translational research is commonly divided into two main phases. T1 translation, basic to clinical, involves taking laboratory discoveries such as genetic findings, cellular behavior, or new medications, and translating them into clinical trials or pilot studies in humans. T2, translation, clinical to practice, focuses on implementing clinical findings into broader patient care. This phase aims to integrate evidence-based practices into standard treatment protocols and healthcare systems. 2. The importance of translational research in reproductive medicine. Translational research plays an essential role in improving fertility treatments and enhancing reproductive health care. Some key areas where translational research has had an impact include A. Developing more effective fertility treatments. Innovative RT, assisted reproductive technologies. Translational research in reproductive medicine has led to the development of advanced ART techniques such as improved IVF protocols, egg freezing methods, and genetic screening of embryos, PGT. Research findings allow clinicians to refine IVF practices to increase success rates and reduce risks. Stem cell and regenerative medicine. Advances in stem cell research have led to potential therapies for conditions that affect fertility, such as ovarian insufficiency or male infertility. Translational research in this field aims to bring stem cell therapies from the laboratory into clinical settings, offering new hope for patients with previously untreatable conditions. B. Improving diagnostics in fertility medicine. Genetic testing and screening. Translational research has facilitated the integration of genetic screening into fertility treatments, such as pre-implantation genetic testing, PGT. Research findings in genetics and genomics have enabled clinicians to screen embryos for chromosomal abnormalities, reducing the risk of genetic disorders and improving IVF outcomes. Personalized medicine. Research in genomics and biomarkers has allowed clinicians to develop personalized treatment protocols based on individual genetic profiles. This personalized approach can improve ovarian stimulation protocols, enhance embryo selection, and reduce complications like ovarian hyperstimulation syndrome, OHSS. C. Understanding and managing reproductive diseases, endometriosis and polycystic ovary syndrome, PCOS. Translational research has deepened the understanding of reproductive disorders like endometriosis and PCOS, leading to more effective and targeted treatment options. Research findings have led to the development of medications that can address hormonal imbalances and improve fertility outcomes for women with these conditions. Male infertility. Translational research has also focused on improving the understanding and treatment of male infertility, including the development of novel sperm retrieval techniques, sperm preservation methods, and treatments for low sperm count or motility. 3. Challenges in translating research into clinical practice. While the potential benefits of translational research are vast, several challenges must be addressed when integrating research findings into clinical practice. A. Scientific and clinical disconnect. One of the main challenges in translating research into clinical practice is the gap between laboratory research and its real-world application. Often, basic science findings do not easily translate into effective clinical treatments. For example, promising treatments that work well in animal models or cell cultures may not have the same effect in humans due to differences in biology, response, or side effects. Bridging this gap requires interdisciplinary collaboration between researchers, clinicians, and regulatory bodies to ensure that research findings are effectively validated and tested in clinical trials. B. Regulatory and ethical hurdles. Translating new technologies, treatments, or interventions into clinical practice often involves navigating regulatory requirements and ethical considerations. For instance, new fertility treatments, such as gene editing or stem cell therapies, must undergo rigorous regulatory approval to ensure they are safe for patients. Ethical concerns related to issues like genetic testing, embryo manipulation, and informed consent need to be addressed to ensure that new treatments respect patients' autonomy and ethical principles. C. Financial and resource limitations. Conducting clinical trials, scaling new treatments, and integrating them into clinical practice can be costly. Research funding may be limited, and healthcare systems may face challenges in allocating resources for new technologies. Additionally, there may be concerns about the cost of new treatments and their accessibility to patients. Securing adequate funding and investment for translational research is essential to move from the discovery phase to clinical implementation. D. Training and education for clinicians. As new treatments and technologies emerge, healthcare providers must be educated on how to effectively integrate them into their practice. This requires ongoing professional development and training for clinicians in reproductive medicine to stay up to date with the latest advancements and guidelines. Clinicians must also be able to communicate the potential benefits and risks of new treatments to patients effectively, helping them make informed decisions. 4. Steps for successful integration of research findings into clinical practice. To effectively integrate translational research into clinical practice, a structured approach is required. Here are some key steps to ensure successful implementation. A. Collaborative research and multidisciplinary teams. Collaboration between basic scientists, clinical researchers, clinicians, and patients is essential. Multidisciplinary teams can ensure that research findings are evaluated from both scientific and clinical perspectives before they are implemented. Engaging stakeholders such as regulatory bodies, ethical committees, and patient advocacy groups is also critical for ensuring the safety and acceptability of new treatments. B. Clinical trials and evidence generation. Translational research requires robust clinical trials to validate new treatments or interventions. These trials should involve a diverse patient population and be designed to test the safety, efficacy, and long-term outcomes of the intervention. Long-term follow-up studies are essential to ensure that any new treatments have lasting positive effects on patient health and reproductive outcomes. C. Adoption of best practices and guidelines. As new findings are validated and proven effective, clinical practice guidelines should be updated to incorporate these findings. This ensures that healthcare providers have access to evidence-based practices that can improve patient outcomes. Dissemination of guidelines through professional societies, academic journals, and training programs is essential to ensure widespread adoption of new practices. D. Ongoing research and innovation. Translational research is an ongoing process. As new technologies and treatments emerge, continuous research is necessary to refine and optimize clinical practices. Encouraging innovation and supporting research in reproductive medicine is crucial for the development of new therapies and the improvement of patient care. 5. Examples of successful translational research in reproductive medicine. Some successful examples of translational research in reproductive medicine include A. IVF and ART advancements. The development of in vitro fertilization, AVF, and other ART procedures is one of the most significant examples of translational research. Basic research into reproductive biology and embryology led to the development of IVF, which has since become a standard treatment for infertility. Innovations such as embryo freezing, genetic screening, PGT, and egg sperm freezing have further improved IVF success rates. B. Genetic screening and pre-implantation. Genetic testing, PGT. Translational research in genetics has led to the integration of pre-implantation genetic testing, PGT, in IVF. PGT allows clinicians to test embryos for genetic conditions before implantation, reducing the risk of genetic disorders and improving IVF success rates, particularly in older women or those with genetic conditions. C. Stem cell therapy. Stem cell therapy is an emerging area in reproductive medicine. Translational research has shown that stem cells can potentially be used to regenerate ovarian tissue, treat male infertility, or provide solutions for women with diminished ovarian reserve or early menopause. Research in this area is still in early stages, but holds great promise for future fertility treatments. Conclusion: translational research is critical for advancing reproductive medicine by bridging the gap between laboratory discoveries and clinical applications. It involves rigorous clinical testing, collaboration across disciplines, and careful consideration of regulatory and ethical issues. The successful integration of research findings into clinical practice enhances the effectiveness of fertility treatments, improves patient outcomes, and contributes to the ongoing advancement of reproductive health care.